Luke Schellenberg, I'm an ENT doc. So patients come in sometimes and they're, especially they bring their kids in sometimes and they have recurring ear infections or they have fluid that's been stuck underneath the eardrums for months and months. And sometimes this happens to adults too. And so this is basically the spot that we're looking at. When I'm looking through the ear canal and looking at the eardrum, I can see underneath the eardrum, almost kind of like you can see through a window into this space here. Now, it's not exactly a clear window in some patients, but we can a lot of times see that there's fluid there or do other tests that say, hey, this eardrum's not moving. There's fluid in that area. And so sometimes when we see that, we think, well, what can we do about it? Now, we can try medications and try different therapies, but the long and short of it is sometimes we have to go ahead and put in a tube. Okay, so a tube sits in the eardrum. Now, sometimes patients may say, oh yeah, you're going to put that tube there and the fluid is going to come out this way. Actually, that's not the way that the tubes work. The fancy name for tubes are as pressure equalization tube. And so basically what we want is the pressure from the outside to equal the pressure underneath the eardrum. And so if you think about it, if you've got fluid all stuck in the middle ear space and we open up the tube there, I've got fluid here, I've got water here, but if you fill a straw up with water, you can go to any restaurant, fill your straw up with water, and you put your finger on the top of the straw, the fluid stays in the straw. Well, you take the fluid out the top of the straw, and that fluid will drain out the bottom. Now this space is dry, and so with equal pressure, the fluid kind of gets pushed down, and we dry that space out. And so if you have a dry space, especially if kids are getting recurring infections, bacteria don't grow nearly as well in a dry space as much as they do in a wet space. You think of the difference between a swamp and a desert. You don't see a whole lot of, swampy, leafy, green trees all over a desert. It's dry, and that's really kind of the space needs to be dry so the bacteria won't grow there. But also, if you've got a bunch of fluid there and that space will dry out, your hearing's going to be better. And so a lot of times when patients come into clinic, for adults, we'll think about going ahead and putting in a tube and getting that space to dry out. So that's the way that the ear tubes will work, is with that by kind of equalizing that pressure. Okay.